Yes.
हाँ एक मिनट.
We can't hear you. President, we can't hear you. Yes, please go ahead.
Yeah, meeting call to order.
Thank you, President. I request President Rotarian PHF Ritika Gupta to confirm the minutes of the previous meeting.
The minutes of the previous meeting were circulated on our Rotary group, and I believe everyone has gone through them. Since no queries have been raised regarding it, thereby the minutes of the previous meeting stand confirmed.
Thank you, President. Good evening, everybody. Today is we are talking on the topic of World Kidney Day, kidney health for all, a very important topic. We have an eminent speaker today, Professor Ray Chaudhury, MD, DNB, DM, Nephrology, Professor, Department of Nephrology, PGMER, Kolkata. I request Rotarian Ashita Yadav to please give the introduction of the guest today.
Thank you, ma'am. Good evening, Charter President Rotarian Lal Goyal, Inspire President Rotarian PHF Ritika Gupta, Inspire Secretary Rotarian Ruby Agrawal, guest speaker Professor A. Chaudhury, and everyone present here. It is my great honor to introduce Professor A. Chaudhury, a distinguished nephrologist and transplant physician. She is professor in the Department of Nephrology at NBMCH and PGIMER, Kolkata, and a highly respected consultant nephrologist and transplant specialist. Professor Chaudhury has played a major leadership role in the field of organ transplantation in India. She has served as president of the Indian Society of Organ Transplantation from 2023 to 25 and as vice president of the Indian Society of Nephrology from 2021 to 2022. She has also contributed significantly to national policy and professional bodies, serving as Joint Director of the Regional Organ and Tissue Transplant Organization for the East Zone and as a member of the Apex Technical Committee of NATO. An active academician and researcher, she is a member of the editorial board of the Indian Journal of Transplantation and has authored more than 70 research publications in national and international journals. Her work has greatly contributed to advancing kidney care and organ transplantation in India. So, ladies and gentlemen, please join me in warmly welcoming Professor A. Chaudhury. Ma'am.
Thank you, Rotarian Ashita, and welcome Dr. Chaudhury and giving us your valuable time to our club. Over to you, Dr. Lahiri.
Well, thank you for your kind introduction. I think you have taken up a very time-appropriate job, which is a very much need. And through my small presentation, I would like to highlight that how important the job that you have taken is and how greatly it would contribute to societal health. I'm sharing my presentation and we'll talk about it. I think my presentation is visible.
Yes, yes,
Yes.
doctor.
Yes. So we are on the eve of World Kidney Day. In fact, we have crossed it and we are on the week, and we almost observed the whole. Just a minute, I'll minusculate. Yes. So you can see the this World Kidney Day theme, that is kidney health for all and caring for people and protecting the planet. So, first, our priority is to protect our patients, and we know how importantly patients' health is integrated to the planetary health, that we will discuss a bit, which will further expand our action points where we would work throughout this month and this year to advance the kidney health. I think the slide is not moving. The slide is not moving. Can I share again?
Yeah, please.
Sorry. What happened? Screen sharing. Yes. I think now it would be fine.
Yes.
Yes. So, what are our action points? We consider the chronic kidney disease, chronic heart disease, and the liver disease. All of these are now important non-communicable health threats, because we are seeing that the communicable diseases are being managed through vaccination and several healthcare policies. And nowadays, mortality and morbidity are coming out of common these non-communicable diseases globally. And chronic kidney disease is one of the most common contributor to this non-communicating health problems globally. And it disproportionately, chronic kidney disease disproportionately affects the disadvantaged populations. And we know, India being an LMIC country, the India being an LMIC country, the large number of people live beyond poverty line, and they are constantly threatened by several environmental hazards which also contribute to their kidney health. And CKD itself is not that a CKD patient dies only due to dialysis, transplant requirement, and not meeting that. On the journey of CKD, through early CKD to late CKD, they have a high burden of cardiovascular disease. Many patients will lose in between the CKD advanced stage and early stage due to cardiovascular mortality, due to premature mortality. In our population, we see chronic kidney disease affects people at the younger age. In Western population, the age of chronic kidney disease is a decade later than ours, the societal cost goes high because we have to subsidize dialysis for a huge number of patients because the CKD is diagnosed late. Many people do not have the access to the health care at right time. So early disease diagnosis is a problem. There is reduced productivity. Who are most affected by chronic kidney disease? The younger age population. In Western population, above 50 is the highest to be affected by CKD. Whereas in our population, we find an increasing trend of CKD after 30, 35, 40 because of this early diabetes, hypertension, glomerular diseases, and another CKD of unknown cause, which is due to the environmental heat stress or the fluoride endemic zones or the several environmental pollutants threatening the kidney. So we have in our patient a lot of CKD footprints. Okay, it's troubling. The slides are not moving properly. Sorry,
Uh,
the slides are not moving.
Doctor, if it's not, then you can speak. Oh, now it's moved. Yes, it's
Yeah.
moved. Yeah.
So, yeah, I have got the advancing point. I have got the advancing point here.
Yeah.
So, there is a WHO resolution, World Health Organization resolution on CKD. The 78th World Health Assembly approves that. It urges governments to integrate prevention, early detection, management of kidney disease into national non-communicable disease strategies, expand access to equitable, sustainable, and high-quality kidney care, including dialysis, transplantation, and conservative kidney care. So, along with that, we find that World Kidney Day theme is a key for raising the awareness among people as well as among the elite group who are educated and bears the message for kidney care to every strata of healthcare so that it gets approved by government. So, World Kidney Day theme is kidney health for all, caring for people as well as protecting the planet. We will discuss how the protecting planet comes in and also kidney care on the environment and to pivot the healthcare models from a focus on late stage treatment to early state risk reduction and detection. We are coming to current model of kidney care. As you can see, the kidney care is now late detection of CKD, and then this CKD, the burnt out CKD patients, they progress to the kidney failure, they need transplantation. The largest population goes for the in-center hemodialysis. Till 2016, hemodialysis centers are not that closely available or it is not subsidized by government. From 2016, the PMNDP project and various state health projects did advance the subsidized dialysis and established dialysis centers in almost each district of India. So the accessibility of dialysis center increased. So people now are more into in-center hemodialysis, which generates a large amount of solid waste because the dialyzers are disposed, the machines are disposed. There is a lot of water expenditure, electricity due to travel reaching to the dialysis center. There is a lot of greenhouse gas emission, which contributes largely to the global warming. And on the other hand, in a vicious cycle, global warming affects the kidney health through heat stress. You are aware about the Uddanam nephropathy of Andhra Pradesh, which had been reported in Sri Lanka, Guatemala, and in many Mediterranean countries as well. There are heat stress related chronic kidney disease. So we prefer the home-based dialysis. In the sustainable dialysis, we promote peritoneal dialysis. And of course, see the blue line, which is transplantation here, which is only received by 8 to 10% of our CKD population. in our sustainable kidney care model, transplantation has been given the highest importance rather than in-center hemodialysis. Home dialysis or PD has been given the most important. And whenever the dialysis is required, we have to have a concept of environmental friendly dialysis strategies where our waste disposal or waste recycling would be contributing to the planetary health rather than decreasing the safety part of the planet as well as the patient. So environment friendly patient as well as planet care evolves as the main point of today's healthcare. So what we need to do if we want to do really something to reduce risk, whom we should go to whom we should go? We should go to the at-risk population. Who are at-risk population? People who have developed diabetes, hypertension, who had many congenital kidney diseases or genetic kidney diseases, family history of kidney diseases, or many infections, lifestyle problems contributing to the kidney care, compromising the kidney health, and also the bad living conditions, difficulties to reach quality care. So, these are the target population to whom we should reach and talk about kidney health and try to detect the disease early when the disease is symptomless but is hidden underneath, and we can see only the tip of the iceberg, not the huge portion underneath. And if we can catch hold of this population where just proteinuria has started, just creatinine has risen up, we can delay dialysis, we can prevent many cardiovascular mortality and morbidity. So people with risk factors for CKD, general population aged more than 45 years, we should go for urine testing, albuminuria testing. We should screen them for EGFR, screen them for CKD risk factors, and educate the public and caregivers, people like you who belong to educated group and an advantaged group of receiving these inputs should carry on the message to the community, and we will be always with you to carry that message to them. What are the environmental hazards that can affect the kidney? Yes, it is the global warming. It is due to lot of greenhouse gas emission, and you know that we can decrease by changing our working condition, changing our mobility means. We can decrease the greenhouse gas emission. We can adapt the living conditions, preferring building cooling, greenery, and we can also be prepared for many floods, hurricanes, and typhoons, which can more increase this greenhouse gas emission and can acutely threat the kidney health. So these all are the action points that are to be taken. And on the other hand, decreasing dialysis and promoting transplantation, promotion of organ transplantation can decrease the huge waste generation there in the dialysis. When we cannot leave dialysis out because there will be many patients who are not appropriate for transplantation as well, and we would advise either dialysis or conservative care to continue. But we know in organ donation region there is a huge demand supply gap, that promoting disease donation, among living donation, promoting swap donation can address the donor pool crisis and can increase the rate of transplantation to give our patients a much better quality of life. Yes, dialysis will immediately save life, and as many people can go on to transplant, they can have an improved quality of life, longer life to live. And we can, of course, go for a eco-friendly dialysis by improving the transparency about manufacturing and transport emissions, spend, dialyze it, and RO reject recycling, decrease manufacturing and transport emissions, and register and diminish emissions of unit level. Many other action points which are to be taken by the specific group involved with dialysis. What you people can help us is really the education, the press campaigns, the social media campaigns, and so how to avoid paid donation and how to improve the technical and institutional support on organization of transplant. So different actions to make kidney care sustainable according to the topic and target population are kidney care in crisis. All people with CKD are the target population. All crisis situation, as I have mentioned, the natural calamities as well. All crisis prone countries and regions which are threatened by, suppose, the specific areas where the heat stress is going on, the area is fluoride endemic, or the area does have high proportion of heavy metals in the water, so that there can be actions on side of the government to decrease the CKD population there. You can create awareness among the authorities. You can develop less rescue dependent therapies, development of less rescue dependent therapies, development of disaster preparedness, and entire community involved in kidney care need to know that how to create awareness about kidney health, so that the burden of kidney disease at all societal level goes down. So our job is to educate more and more, pass on the information, so that you can become a very good resource person to share the knowledge with community, because you have much better and greater community access than us. So these are few strategies which an authority may take to make an environmental friendly dialysis available. And I should say that the organ donation to be promoted, many things we do. We also promote the World Organ Donation Day observation. We promote Indian Organ Donation Day observation. We do a lot of myth bursting, and we have to keep on doing that, because we always know that knowledge penetrates much slowly than myths. So we have to take a big action and sustained action to offer a sustainable kidney care for the society. Thank you. I'm ready to take questions, if any.
Thank you very much, Doctor, for giving your very elaborate PPT presentation and analysis. Can you just close your PPT presentation, please? Yeah. Now, Doctor, you said the awareness. Yes, awareness is required, because as per the survey, 84% of the population has not heard even the name of organ donation in India. But the question is, what about infrastructure? Forget about the organ transplant centers. I'm talking about organ retrieval centers. As per NOTO, about 15 to 16% district headquarters in India are having facilities for organ retrieval centers. So it means the 84% or 85% population or the districts are not having any facility for retrieval. If I am going, or any one of our members or anyone promote in those areas, their first question is, if somebody is declared brain death, first thing is nobody will be declared brain death there, because there is no brain death committee, declaration committee there, when there is no retrieval center or transplant center. Yes. Second question comes, if at all somebody declared, how is possible to travel 200 kilometers to take the brain dead person to a retrieval center, and after giving the organs, or after the harvesting of the organs, again bring back the body for cremation? This is practically impossible. So what, because you are representing government, you are on the bodies of, my question is, what government is doing to increase the infrastructure pan India, not concentrating only in metros or big cities. Otherwise, there is nowhere in all the districts.
Yeah.
Even,
So if if I try to answer your question,
Yes.
so when I was heading the Roto in East Zone, then several times as we were then were taking baby steps in organ donation in West Bengal. So sometimes because of our intense uh, 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 awareness campaigns, sometimes very small hospitals also started calling that, okay, we have a brain dead person in our ICU. But there is no brain death committee. At that point of time, when a very small nursing home calls for, what I used to do is to instruct the nearest medical college to respond to it. The medical colleges, all medical colleges should have a brain death committee because it is a multidisciplinary committee. There should be one ICU physician, one physician who can see all these type of patients, medicine patients, so a medical person, as well as an administrative authority on behalf of the nursing home center and on behalf of the medical college. So usually a team of 3 used to travel there and used to declare brain death. And because the immediate retrieval preparedness is not possible, if they have an OT, usually the retrieval team from the medical colleges, after the allocation had been done, the private transplant centers or the medical colleges had gone there. But I definitely say this is not an easy procedure. Multiple phone calls, multiple communications, and several problems
yes,
did arise.
I will.
So
Yeah.
from there, this is the problem statement, that how an immediate problem can be solved. It highlights that you need to have a stable problem solution maneuver. So what we did, we have graduated the most of the district hospitals, as their ICU people are trained to declare brain death, and they have an OT where the retrieval is possible. So if then the brain death evolves there, the retrieval can be done in the district medical colleges. So we are giving a call to each state government that make your district hospitals NTRCs. In Tamil Nadu, the organ donation is maximum because even in from the district level hospitals, the organs are shared to the metro. Having a transplant infrastructure in the district hospital in second tier or third tier cities is difficult. But nowadays, the second tier cities also started having transplant infrastructure, not uniformly across India, but the part which have improved organ donation, organ retrieval, or higher transplant rate, there the second tier cities are now also having transplant infrastructure. What we need is, you are right, we have to increase the NTRCs, and we have to increase the ICU people awareness that it is your duty, it's not optional to declare a brain death.
Okay, no, Doctor, with due apologies to you, as per my information and as per the law says, until unless a retrieval center is not being given license for retrieval, no one can do the retrieval in that particular center, whether it's a nursing home or even a district hospital of the government.
Yes.
But
There
unfortunately,
is a Form 13, yes.
so, but
coming to it.
unfortunately, in
So-
India, the license has not been given to a majority of the hospitals. And that's why my question is, until unless we will not have the infrastructure in place, those hospitals, like you are talking about Kolkata, that is fine. But what about the nearby cities? Like today I was in Pune. I asked the same question to them. Pune is having the retrieval and transplant centers, but there are no centers available in the periphery of Pune or in the periphery of Mumbai. So when this is the situation, and then again the question is, how without the infrastructure, the awareness campaign, whatsoever we do in those cities are of no use until unless we have the infrastructure, and for that, government has to come forward. Otherwise, there is one suggestion which I can place from my side is, why not start mobile retrieval center with the hospital which are already doing the transplant. The license will be given on that basis to the mobile retrieval center, and that mobile retrieval center can go to the peripheria wherever the things are declared.
Actually, this happens. I'm sorry to this happens. So when a heart when an organ generates, usually the retrieval persons move from the transplant center out.
Sorry, doctor. I'm not talking of the retrieval team going. I am saying that the mobile organ retrieval center means the operation theater on a van has to go there, because let's not take the patient to travel to 150, 200 kilometers for harvesting the organs and then send back the body. That is practically impossible.
That is not practical. That is not practical
So
in either way, because there might be cardiac arrest on the during the movement, and there might be several issues while the such a hurried transport.
So what I will do now, I am opening the forum for all other members to ask the questions. So please be brief. Please ask the question. Unmute yourself so that I can see. Raise the hand. I will immediately take the name. Whosoever wants to ask the question, please do it as early as possible, so that our professor doctor will be able to give the reply. And she is an authority, so I prefer that please ask the question.
Meanwhile, I will tell you that there is a form number 13, which is the retrieval center license form, whereby some facilities, whether they are existing in the retrieval center or not, are inspected, and if the center agrees, then these centers fill up the form and send back, and they are approved retrieval centers.
Yes, you are right, doctor. But the problem in India, as you know, we tried our best, and I have spoken to many private hospitals also. Their reservation is that there are so much bureaucracy and red tape is, and you know, I should not use those words here in the public forum. So that's why nobody wants to come forward to do it. So I think the best part is the government should start with all the government hospitals which are in every district in India. So at least they will become the retrieval center. I'm not asking for a transplant center, but at least they can become the retrieval center.
It has to be. Which states would do that? They would progress in transplant.
Yes, please ask the question. Please unmute yourself so that I can see. Second point, till that somebody is deciding to ask the question, the cost factor, doctor. As you know, that there are about 650 transplant centers in India. Total number is 650 approximately, out of which about 125 to 150 belongs to government. Rest are all private. And government hospitals, although you are working in government, so I will not comment, but there are only few government hospitals which are doing all types of transplants. While others are only doing only kidney or liver. So the question comes, where the patient will go. Even the kidney and liver, they are going to the private doctors. They have more faith. They have more faith on the infrastructure, and there the cost is too high. Although we have a thing called NBMCH scheme, where for transplant now the limit has increased from 5 lakhs to 15 lakhs rupees by our Honorable Prime Minister. But as you know, our health is a state subject, and the state governments have not implemented it. Don't you think that like COVID time, all the emergency powers were used by the central government, at least for the finance thing? Poor patient, they have no place to go. And they are, and if I pursued it with Maharashtra government, I pursued it with other governments, they says no, that we will decide. Although Maharashtra government the cabinet has passed, but the GR has not yet come. Now, bureaucracy is there. So that is one thing. I can see Rotarian Sunil Gupta is there. Rotarian Sunil Gupta, your question. He's a kidney recipient himself, and he stayed in Sunnyvale, California, USA. Yes, Rotarian Sunil Gupta, your question, please.
Yes, thank you for a great discussion. I have a different question. I'm going to change the subject if you don't mind, because we're talking about on a Kidney Day, World
Yeah.
Kidney Day sustainability.
Yeah.
The growing, the issue with CKD is, the fact that you don't find out until the very late stage.
Yeah.
And with increasing, you talked about pollution and other things. With the AQI indexes and the microplastics? Are there things that can be done preventatively so people don't reach that? Can there be tests, that can be mandated?
That we are highlighting nowadays. We initially, what was there to detect a kidney disease? That was the serum creatinine. But we used to see that by the time the creatinine has been up, is lot of kidney tissue has been already destroyed. So we are now stressing for a point of care test in the urine. Urine is the representative specimen from kidney, which can show you the earliest change in terms of proteinuria. In many diseases like diabetes, hypertension, glomerular diseases, there are few diseases in which proteinuria is also not there. We are trying to find an early marker for them, for the non-proteinuric diseases. But those patients who are having at-risk factors, like they have history of hypertension for more than 5 years, they should routinely undergo kidney screening test in terms of not only blood creatinine but the urine albumin creatinine ratio, which can pick up the kidney disease even much faster than the serum creatinine. So we are in the process of developing many early kidney disease diagnosis markers. Some proteomic and some molecular markers are on the way. In research setup, they are being tested. But the thing that had reached you is the proteinuria in case of diabetic, hypertensive, and glomerular disease patients, which constitute at least more than 70% of the kidney disease risk causes. So, at risk population, identifying the at-risk population. Also, there is a variety of kidney disease where these sort of traditional risk factors do not work. There are villages of Andhra Pradesh where it has been seen that there is an extra prevalence of chronic kidney disease. They are more prone to have. Sometimes people have found some pollutants, heavy metal pollutants in water. Sometimes people have found, I was talking of fluoride endemic areas in Orissa. Sometimes people have found excessive heat stress. This is not only in India, in Sri Lanka, in Mediterranean countries. There also appear certain belts where this type of diseases are. So where these environmental pollutants are concentrating and how they can cause kidney disease, these target populations can undergo mass screening. Any mass screening would have to be initiated from government, and it involves a huge cost which cannot be borne by any small society but government himself. So we are working, publishing research papers, publishing documents, that these are the areas which are the hotspots. Look at these hotspots and give your full preventable action to these hotspots so that these people can be diagnosed early. There are some genetic kidney diseases like polycystic kidney disease, which runs in family. So whenever you find a thread, you look at that what are the other relatives, whether they are having it. If it does have any specific treatment, do that. Or if doesn't have, many congenital diseases do not yet have a addressing treatment. So in that case, what are the actions that can delay the kidney failure development? So we have to look onto that. We have a several, we teach and keep on teaching the several action points and try to take them to government so kidney diseases can be diagnosed.
Yes, so according to you, doctor, the government has to take the initiative, concentrate the things. Rotarian Sunil Gupta, you have any question, or shall I move to the other?
No, thank you. Appreciate the answer. My question was more about what can be done. I know you talked about screening and other things, but I was talking more preventative, right? Because of the awareness of the World Kidney Day. especially with microplastics and things like that? Are there things people can proactively do or take in terms of kidney
Yeah.
flushes or something that you
So-
can
so-
prevent some of that?
Little difficult take details for me. I cannot in short describe you what are the things being done, but plastic recycling is now a very, very favorite topic of the environmental health workers, which they are working with, and they are recycling many things. So we have to be conscious also in using all these things in our household and everywhere, and take these awareness to suppose we are all using bikes to even to travel a small distance nowadays, which I can remember my dad would have taken a cycle to reach the nearest market, while nowadays my family people, anybody would take a car or a bike to reach a market.
See, Doctor,
So
the
that
reason is very clear.
another-
Now, environment is so much polluted, nobody can
Yeah.
go on the bike. Now that, okay, so thank you very much, Rotarian Sunil Gupta. I think Rotarian Deepan Shah has already raised his hand.
I wanted to ask something.
Just a minute, please, because he's driving and he's. I'm giving the preference who are working in this particular field. Rotarian Deepan Shah is from USA, New Jersey. And yes, Rotarian Deepan Shah, please unmute and ask your question quickly so that I can go to the Rotarian Professor, Dr. Sudhir Saran, immediately.
Wonderful. Thank you, Doctor. So my question is, what in my understanding, the nephrologist is a primary key driver for CKD disease. So the ratio comparing between United States and America, India 1.3 billion population, they have average 1.5 to 2 nephrologists, so around 28 nephrologists overall in India. In United States, 28,000 nephrologists, 25 to 30 per million population. So do we have any plan or projection to have nephrologists available in all kind of cities? To
Yeah.
early detection?
Several education programs are there, the DM trainings and the DNB training and various certificate courses which are educating the MBBS doctors even to various aspects of dialysis. So that thing is on board. The number has increased in last 20 years from 900 nephrologists all over the country to more than 3,500 of nephrologists.
But doctor, what he's mentioning, how much you are saying, 28,000 in USA?
28,000, yes.
20, and the USA population is 1/4 or 1/5 of India. So if we multiply, we require
so we need to add more.
more than 1 lakh nephrologists, and you are saying about 3,000 nephrologists. So where it means this is the gap.
What I am highlighting
Yes.
is it is on expand mode. And I think another 10 years will give you another 6,000 nephrologists.
But doctor, we are already 1994 we came out with THOA Act, and today we are 2026, 32 years passed, but still if we are in developing mode, I don't know in which year when we will reach. Anyway, thank you very much, Rotarian Deepan Shah. Rotarian Professor Dr. Sudhir Saran.
Thank you, Dr. Arpita, for a very powerful presentation. We are grateful to you. There's a very, deep interest question for me. Hope you will be able to answer it. And that is, you said there is a connection between nutrition and organ health in general, and in kidney in particular.
Yes.
We, I studied a course called Human Food and Nutrition when I was studying agriculture. And we were taught about macronutrition and micronutrition. Micro being minerals and vitamins, macro being the mega one. Which of the two are very critical for preventing organ problems, particularly kidney ones? The macro or micro, and what is their role? What can we do to prevent it?
So definitely the macro has a greater role in because that decides the main calorie and things. What is happening here nowadays that we are having very connected problems. Usually you will find the Indian body is the central obesity. We are centrally more obese. Our organs do have lot of visceral fat rather than fat in our body portion. So initially we thought we didn't know even in the later part of last century that these fat, this excess adipose tissue which we bear across the abdominal viscera are really toxic things. But these are the real toxic things. This is developing because of our excessive carbohydrate dependence and less physical activity. The change of the usual food pattern to the fast food pattern and more ingestion of the fatty food and more ingestion of meat, which it gives rise to a lot of acid formation in the body. When the kidney is diseased, it finds real difficulty to tackle the excess acid production in the body. In protein portion, fish and poultry are the better proteins. You can give vegetable proteins as well. A lot of Indians are vegetarian, and we are finding vegetables are rich in micronutrient as well. Those are good, but sometimes they are deficient in one or other essential amino acids which body requires. So if you decide to go for a vegetable protein resource, you have to balance it by using several types of vegetable proteins which can give you a complete essential amino acid group. And for non-vegetarians, which in India is also a lot of people, so fish and poultry are the preferable, and white lean meat to some extent. The red meat that we enjoy quite a lot may not be the ideal kidney supportive
Yeah.
thing.
Okay, thank you very much, Rotarian Professor Dr. Sudhir Saran. Doctor, I have just one thing to inform or ask you. If it is like this, that you are saying everything, government is doing so much work, and we all know that everyone is trying. Till date, as per my information, only 2 brain death transplant took place in Kolkata.
No, very wrong information.
I'm talking from this. I'm talking on this year, 2026. In last 3 months, if you want, I can send you the press release of this thing. So, this is anyway. I can see
in
now.
Last 3 months. In last 3 months.
3 months, so only 2. So
Might
one can imagine in 1 year, multiply by 4 is about 8 or 10. This is nothing, negligible development. So this is not a good thing, but I can see
one answer like an escapist I may talk about. That is, I am not in charge of
no, I'm
Roto
not saying.
nowadays. So I directly modifying the action of Roto is little difficult for me. When it depends on the people who are driving in the driving seat, that how intensely the program would work. It depends. And when I started in 2017, there was no SOP prepared, nothing on board there, but the strong drive that we have to do.
The problem, Doctor, sorry to interrupt you. The problem is that because the health is a state subject, SOPs are there in many of the states already from 1990.
In 2017, a very strong SOP has been given to West Bengal government, and that is being followed. At that time, I used to look after the Roto as joint director.
Yes. I can see now Rotarian PHF Dr. Rohan Monis there. Rotarian PHF Dr. Rohan Monis is the administrator of a very big hospital medical college in Mangalore, Karnataka. Yes, your question, please.
Madam, good evening, ma'am.
Good evening.
Beautiful presentation, like on the dialysis and preventing waste. Ma'am, in your presentation, you had one like a very beautiful point talking about promotion of organ transplants. Okay, we talk about promotion of kidney transplantation, but if a patient doesn't qualify for it, you need a backup of a renal replacement therapy or dialysis. Madam, presently, if I see in my district, the government hospital is really struggling and is not able to cater to the needs of these people. So what we've done is, here's a private medical college hospital. We are running dialysis. We're giving subsidized dialysis for these people. A lot of NGOs are supporting them. Ma'am, this is becoming a big gap within the system, number one. Number two, especially during COVID, we had these very sick patients requiring dialysis. And like, the COVID rules were very strict in this. We cannot take money from them. We can't do this from them. And it is all the government for pricing. But these private hospitals don't even get Ayushman Bharat the clearance for dialysis in spite of setting up facilities. And can you throw some light on that? Because
Yeah.
that's a huge gap. There are a lot
I'll
of patients
take your
going
question.
towards dialysis.
Yes,
But
yes, doctor,
the
please.
I'm taking up your question.
Yeah.
Yes. So in Kolkata, the big transplant doing centers, in Kolkata, you will find lot of living donor transplant doing hospitals, private hospitals. I know two or three private hospitals, large scale. One is Rabindranath Tagore. They are utilizing both Ayushman Bharat for people who are traveling from other states to have transplant done there, because in West Bengal the Ayushman Bharat is not utilized, and it is always the state policy, that which state will pick up the central government health support, or they will themselves create. In West Bengal, such a state support is Shastro Sati, and state promotes that. So our state people enjoys the Shastro Shati benefit, which gives around 4.5 to 5 lakh, even in a private hospital, if the private hospital does go for, ask for that support. So the thing is definitely with Karnataka government that you need to reach them. And about this private the district hospital not having the adequate dialysis capacity. So there is a PMNDP project which was launched in 2016, that is central government supported dialysis program. So that has made us you have to establish in each district at least one, and all state has to show 100% penetration of this dialysis unit. In North Bengal, in West Bengal, if you think, there are many difficult terrains where dialysis establishment, center establishment, taking, because that is the mountain regions in the Kalimpong, Darjeeling. I myself have addressed those hospitals and supported the government initiative to establish centers there, and really it helped local people, because on the days of the natural calamities, traveling 3 hours to planes to have dialysis was used to be difficult.
Okay. Doctor, now my
So,
last thing, because our time is
yeah,
uh,
yeah.
you might have read in the newspaper 4 days back or 3 days back, there was a lady in Uttar Pradesh who was traveling, who was declared brain dead, and who was traveling to another city, and in the ambulance, and there was a pothole, and she became conscious, and the treating doctor, the other neurologist said it's snake bite, and he treated, and she's perfectly all right. We all know that this is all false, because
Yes.
it is not possible. But why no statement has come from the government body, Noto, Roto, or Soto, some authorized person should come on the television, on the media, because all media channels, on media newspapers, even like Times of India or Indian Today or everyone has reported.
I myself noted that on social media.
Noted means why? No, my question to you is, because why no one from the government side? See, one 10-month-old daughter, child, declare brain death due to the road accident. That was also wrong, but it was highlighted in such a way that a very noble deed has been done. But I'm sure people are not aware in India. I want to tell everyone, of all our members also, in India, the car seat for the child car seat is compulsory under section 194 2B of Motors Act. But it was not implemented, and we were glorifying, we were praising the parents, while they have done a criminal negligence, and the child has lost their life. Afterwards, they have, and we were not talking about the real root cause. We are just glorifying the organ donation, but we are not talking about the root cause. Why, when the government will come in actuality, whether the central government or the state government, or irrespective of the party, I'm not talking of the party politics, they or the Noto chief or the Roto chiefs or the Soto chiefs to clarify this thing. People are sending us the messages. What? Please give us the comment. What comments? We all know that the brain death is an irreversible thing. So we all know that the child negligence, how much strictly you hold the child in your lap. If the accident occurs, the statistics says all over the world that you cannot save the child. Why it is not been circulated properly? by the government. So this is that I know that you will say that you are not the on that position of that, but it is required. So whenever you are meeting to the Noto or Roto, Soto, please
It will
tell
be
them.
day after tomorrow. We are having a meeting in Delhi.
So if you are meeting in Delhi, please tell them to come, tell the public at large. They should not shy away when we are giving full 2 pages ad in the newspapers about the organ donation. We should also give the real facts, because the people start thinking that what we are talking about organ donation is all false. A person can be declared brain death and he can be again get the consciousness. It means the doctors are fooling us. The people who are promoting are fooling us. So please, my request to you, when you are meeting
may I give a single line comment?
Yeah.
So these facts are definitely wrong. The person might have been, the brain death is declared on 2 occasions, not by one person, by 4 signatories. So 2 occasions, 6 hours apart, declaring brain death through positive apnea test is least likely to be wrong.
No, it's a question is why the name of those 4 doctors, if they have given a wrong report declaring brain death, why there is no prosecution against them? Number one. If not, then who has declared the brain death? No one is authorized to declare brain death except the committee of 4 doctors.
The most possible thing is, I don't know the exact
So that is the problem in India, doctor. We are just guessing. I'm also guessing. You are also in dark. We are also. That's why we want a authority to give a press release that this is the factual thing, so that people will not be in this. Thank you very much, doctor, for giving us so many questions, and people wants to ask many questions, but you have very patiently asked the questions. So over to you, Inspire Secretary Rotarian Ruby.
Before that, I would like to ask one question, ma'am, if I can. Very quick question. Ma'am, you were talking about how plastic interferes with kidney health and, we should be avoiding. And you went on to talking about some clothes that have been made out of recycled plastic. So do you dissuade people from wearing those kind of clothes? What is it? I don't think I got an answer to that.
I don't have an answer to that, and I cannot dissuade it. But in our personal practice, suppose cleaning the kitchen table, just as we too are women, and definitely we are more frequenters to kitchen than male counterparts. So if you remember, your mom might have mopped the kitchen table with a piece of cloth, which she washed again and again put it for drying and reused it. So it was not added as. But if you go to, just few days back, I was in UK, in Oxford, with my daughter, and I was constantly using, to mop the kitchen table, I was constantly using a tissue paper to make that. So that's generating, adding to the lifestyle factors that we are adopting. This is a small example, is adding to the waste, continuous waste generation.
Right. Thank you very much. Over to you, Inspire Secretary. Yes.
Thank you so much, Dr. Arpita, for a wonderful session and your patient answers to all our questions. I request Rotarian Jyoti Galada to please give the vote of thanks.
Good evening to all, and we couldn't have a better discussion on World Kidney Day better than this. This was so elaborate and so intense. And I first of all want to thank everyone for taking out their time and sharing all their knowledge. And of course, a special thanks to Dr. Arpita Ray Chaudhury. Her answers were so powerful, and we could completely see her knowledge through her answers. And thank you very much, Doctor, for creating so much of awareness in the kidney health. Also, not taking much of the time. As usual, thank you to Lal Goelji for another powerful session that he has organized. And thank you to Ritika Gupta ji and Ruby ji for being here. Thank you.
Thank you. Thank you all. Good night.
Thank you, Rotarian Jyoti, and thank you, Dr. Arpita, once again for a wonderful presentation and discussion. And thank you all Rotarians to attend this meeting today. Thank you all.
Rotary Nitika.
Meeting is thereby adjourned. Thank you.